Hi Mimi, thanks for taking the time today to do this video. So let's start off with just telling us a little bit about yourself.
So hi, I'm Mimi Fayer, LMFT, and I have been a therapist for quite a few years now, and I now work at Los Angeles Therapy Network. So I specialize in working with mood disorders, particularly depression, any severity, and also trauma. So I had a lot of experience working, especially with victims of childhood sexual abuse. So that is what my particular specialties are. But I've had exposure with any types of trauma, whether it's physical abuse, neglect, emotional abuse as well. Those things. Yeah. So that's a little bit about me.
Okay. Um, can you sort of tell us about how your first session would typically go? What is your
Well, in my first session, I like to get to know my client. First of all, I feel like in order for therapy to go anywhere, I need to know what's the objective, right, of my client being in therapy, and also to kind of see if we are a good fit in terms of therapist-client relationship, because it's imperative for that relationship to be good in order for you to kind of you know have any growth or make any changes or reach the goals that you would like to reach for coming to therapy. So that's what I look for in our first session. Just kind of like getting to know each other, not only me getting to know you, but also for the client to get to know me as well as a therapist.
okay? And Mimi, like what personally, what brought you to this field? Like what got your interest in this field?
So it's funny, but I always love history. So any types of history, but I just feel like the field of psychology applies that well for me in terms of interpersonally, correct? So I get to study the history of a person, which makes them who they are today. Combine that with personal experience. I've had experience myself with therapy, and I see that I can grow from it and make positive changes to my life. So I feel like being able to help others see that and make gains through therapy is a very rewarding job or career to have.
Okay. So how do you define your success with a client?
My success with a client would be them reaching whatever goal they have in mind for coming to therapy. So it's not what I set for them, but for what we work together to set. For whatever they want to reach, right, in the beginning. So whether that be small or big, it doesn't matter. It's more what the client view as what they got out of the time we spend together and working on. So whether that's a change, whether that's some skills they learn, or just having someone to talk to and connect with, anything, that is a success for me, to be able to reach and connect with a client.
Okay. And is there a difference in how you perform therapy in a private practice like LA Therapy Network versus, let's say a big medical center or, facility or clinic?
I think there's a vast difference. So I used to work in a DMH, which is Department of Mental Health contracted sites, and I see a lot of limitations. So what it is that when you are dealing with those big medical facilities or insurance, you are given limited sessions, or you're often limited to what you can do with a client. So whether I see or the client also see that they would benefit more for ongoing therapy, sometimes because of those limitations by medical facilities, it doesn't allow us to do that. Whereas therapy in private practice, you make therapy what you want it to be. So whether you want to see a therapist weekly, bi-weekly, or what have you, or just come in whenever you feel like you need someone to talk to, just to brush up on certain skills or just to have someone to talk to, you can totally do that at your will, right? It's more of a commitment that you make in what you want out of therapy. But I feel like insurance and medical facilities are very limited. And usually they give you a certain amount of sessions and that's it, for a year. And I don't believe that that is helpful. I mean, it can be a scratch to the surface or anything like that, but to do deeper work, to really heal or to really make a change, that's not gonna be as effective.
Okay. Is there a general philosophy that you sort of believe in or follow about therapy?
I don't have particularly any philosophy. My philosophy is I'm trained in a very multicultural, sensitive approach, with also, like, I use eclectic approach when doing therapy. I basically tailor everything to the needs of my client. So whether I can take from this, approach to make, therapy better for my client, I do that. So I don't stick to any particular philosophy per se. I just feel like whatever fits the most for my client, for them to benefit out of therapy, that's the approach I take. And that obviously comes with, having spent time with the client and working with them for a while to figure out, okay, this, type of treatment works for them.
Okay, great. Well, thank you, Mimi, for your time. This is Mimi Fayer, psychotherapist at LMFT at LA Therapy Network.
Thank you.